Good morning and good afternoon. My name is Andrew Armstrong, and I'm grateful for the opportunity to share some thoughts about monitoring affordability of rural water services through crises, using water production trends during the COVID-19 crisis as an example. As Rob and Guy have already established, affordability is a complex concept that's difficult to monitor even in times of stability. The tension between affordability and financial viability of services only intensifies during environmental and public health crisis when users' livelihoods, availability of alternative water sources, and cost of delivering the services are impacted. Adequate and timely information is even more challenging to obtain during crises, and yet is essential for directing appropriate policy responses. Over the next few minutes, I'll be presenting findings from a desk study that examined changes in water production in rural schemes over the past several months to gain insight into the early impacts of the COVID-19 pandemic on affordability and financial viability of the services. It's much more feasible to measure the direct changes in water production in a rapid manner than household level consumption or expenditure. We're interested in whether these changes can act as an early warning system for flagging affordability issues during times of crisis. The study analyzed 474 months of water production data from 43 rural schemes in 7 countries, all of which are supported by the NGO Water Mission. These included kiosks with point source access, as well as reticulated schemes with multiple communal and private connections serving households, schools, and healthcare facilities. In all of these sites, tariff structures and levels are formally established and are not allowed to fluctuate unless agreement is reached together with users and local authorities. Water meters fit with data loggers and satellite-based transmitters are installed on each of the schemes and have been providing ongoing information dating back as far as 2016 in some sites. I looked at the mean monthly water production from the period of January to April of this year for each scheme and compared to production in April alone, which is the month we might expect impacts of COVID-related work and travel restrictions to materialize on a global scale. I also calculated historic means from January to April for every year between 2016 and 2019 in order to determine if the trends observed in 2020 differed from what has historically occurred at these sites. Finally, I explored whether significant differences in the change in water production in April occurred between countries, schemes with different tariff structures and levels, different types and sizes of schemes, and service areas where schools or healthcare facilities consistently use and pay for water. We'll first look at the results considering the implications of tariff structures. The bars in this chart illustrate the magnitude and direction of change in water production from the monthly average in the first 4 months of 2020 to April for each study site. You can immediately see the changes range from large decreases on the left to large increases on the right. Consistent changes in water production, which might indicate that COVID-19 restrictions are affecting water collection and payment, have not yet been observed in rural kiosks or reticulated schemes of any size, except in the small group of service areas with flat tariff structures. These schemes experienced an average increase in water production in April of 12% or 50.3 cubic meters, which was statistically significant and was generally not historically seen in the same sites nor consistently in areas with volumetric tariffs. This data does not allow us to attribute these observations directly to COVID-19 because of the likely influence of other factors which I'll describe on the next slide. However, it's plausible that increased water production in sites with flat tariffs could be linked with infection prevention and control measures, because users are able to collect as much water as they wish without being hindered by the cost. Although it might be expected that volumetric tariffs, particularly container-based fees, might deter increased water use that otherwise would occur during public health and broader economic crisis, the phenomenon has not yet been observed in the study sites. The primary takeaway here is that water production has not uniformly decreased or increased in service areas that are reportedly continuing to enforce container-based fees, indicating either affordability is not yet a concern, or at least it's not influencing the volume of water users collect. We've not yet been able to examine the financial data from these sites in April to determine whether these changes in volumetric production are mirrored by changes in revenue or if payments are being missed. However, it's reasonable to anticipate that large monthly payments, whether flat or volumetric, will be more difficult for households to make when livelihoods are disrupted than small container-based payments. When we reorganize the chart by country, we can see there is a high degree of variability in the changes in water production between different countries, even among those within similar geographic regions. This variation illustrates the fact that impacts of the COVID-19 crisis on rural livelihoods and affordability of water services are highly influenced by local factors. The extent to which rural livelihoods are affected is largely dependent on coordination and enforcement of restrictions on travel and economic activity enacted at the national or subnational level. Furthermore, it's impossible to disaggregate the impact of localized rainfall patterns from that of COVID-19 in rural areas. The schemes in Tanzania are a prime example of this. The statistically significant decrease in water production in these sites, which is a marked reversal of historic trends, is anecdotally due to a prolonged rainy season and subsequent availability of alternative water sources, rather than the impacts of COVID-19. This suggests that a rapid response to support affordable services is even more critical if an infectious disease outbreak occurs during the rainy season, when people are likely to opt for alternative microbiologically unsafe water sources instead of paying for safe water services. Combining water production data with other publicly available data sets such as rainfall levels could enable relatively rapid insights into such phenomena. However, even in the absence of other data, production data can provide a global snapshot for monitoring and quickly detecting water use changes across geographies. The data I have presented is automatically collected, transmitted, and analyzed by satellite-based remote monitoring systems installed and supported by Water Mission, and is fed into government-led monitoring systems where feasible. Although remotely monitored water production data alone does not provide clear insight into user-level affordability, we believe it can act as a proxy, potentially even providing a basis for smart subsidies that enable continuous service delivery in rural areas where affordability is a known concern. Ongoing monitoring of operation and finances is critical for evaluating the impact of COVID-19 on affordability and service delivery in a timely manner. Such monitoring requires strong networked information systems that can produce early and reliable insights, like what the Johns Hopkins Global COVID-19 Dashboard has been able to do for disease caseloads. For those who are interested, in the coming weeks we plan to expand the analysis I presented to consider trends in revenue and rainfall at the study sites, and intend to publish the findings. I want to thank Water Mission for generously allowing the use of the data and providing timely input from various field offices on this study. I'd also like to recognize the REACH program for sponsoring this webinar and the Rural Water Supply Network for coordinating and hosting it. I'm happy to answer any questions now or via email and look forward to the panel discussion.